Hello, my name is Sachin Klarn, and my Global Health Innovation Conference abstract started roughly about 8 months ago. I decided to start a vision screening clinic in our underserved community population, and I thought to myself, why don't we have ophthalmic imaging in these clinics? And the thing that I found was that it was very difficult trying to get the equipment that we needed into the community, mostly because we have to be very careful with the equipment. It costs tens of thousands of dollars. And then on top of it, it also takes a trained professional to actually use the device itself. Now, the reason why I wanted the imaging into the community was because it's very difficult to screen for retinal diseases such as diabetic retinopathy and glaucoma, which roughly account for 9% of the world's preventable causes of blindness, without getting a really good image of the back of the eye. So I started thinking, why not use the technology we already have in our hands, which is our smartphones, to be able to take the images that we need in the community of the back of the eye. So I started designing a 3D printed camera that could attach to any smartphone as part of my innovation. Now, the device itself I had to do a little bit of research on. And for me, 3D printing is the next big thing. It's been around for it's been around for a very long time, but it's now become a household item. There are 3D printers in your home. There are 3D printers in at the library. There are 3D printers in the community centers, and there's even 3D printers that we've been using for a long time in the industry. So the key fact here is that 3D printing is becoming a viable option. So that's the reason why I decided to 3D print my device. Now, when I did my research, this concept has already been done before. There have been 3D printed cameras that have been attachable to smartphones. Companies like Peak and universities like Stanford as well as Berkeley have already designed 3D printed adapters for your smartphone. However, the thing when I was designing my device was that these companies or these models that have already been done before either are stuck or limited to one phone or one device, or had a very narrow, limited field of view, which made it very difficult to get a really good diagnosis of any retinal disease. So I created a criteria for my device, one of which had to be versatile, which meant that it could be used on any smartphone with a 5-megapixel camera. The second thing is that it had to be small, it had to be light, it had to be durable so that you can take it overseas, you can take it through security, you can take it wherever you need to in the community, and it would be easily attachable and you knew it would work reliably. And then lastly, it had to take very good, high quality, wide field views of the retina. And the reason why we need wide field views is from an ophthalmic standpoint, we need that view to be able to make an accurate diagnosis, to see other things that are going on in the retina rather than just, say, for instance, the optic nerve. So it's important that we have the wide field. So I'm really proud to say that I have a camera or at least I have a design that works. It takes really good high quality images. The only thing is it needs to be cleaned up a little bit from glare and reflection and things like that, which is in the process right now. But the more important thing that I'm looking for from this conference and from this abstract proposal is that I'd like to get my camera clinically tested, which means I need to use it on patients and see if it's comparable to cameras that we already use that are tens of thousands of dollars, and make sure that we can actually use it to make diagnoses. Now, at this point, what I'm really looking for from at least the conference and things like that are people who can help me with marketing, and then also investors to get this device off the ground. I need to get this designed, fabricated, put together, and that way it can actually get out in the community and we can actually make a dent in this 9% of preventable causes of blindness. Now, my goals in general are that I would like to have this design out to the public. That way people who have the knowledge or at least the technical skills to be able to put the device together can use those community centers that I said before to actually print the design themselves and then just buy the build of materials and put the device together. So what I'm looking for is help to get this device off the ground, and I hope that this abstract is going to help me do that. Thank you very much.